from the National Brain Tumor Society shows that there are currently 1 million Americans living with a brain tumor.
And with August being Neurosurgery Awareness Month, we've invited Dr. Alexander Kalesi, the chair of neurosurgery at UC San Diego Health, to help us learn a little bit more about the important work that neurosurgeons do. Thank you so much, Dr. Kalesi, for coming in. We appreciate it.
Great to be with you.
Let's talk a little bit about that, because not everybody knows what a neurosurgeon does. Tell us about that, and how do they differ from neurologists?
Sure. So neurosurgery is a specialty that focuses on interventions in the brain. So that involves open surgery of the brain or the spinal cord, or using catheters to treat problems in the brain. And one of the really exciting things and why Neurosurgery Awareness Month is such an opportunity is because what we're able to do to treat neurologic disease has changed dramatically over the last 10 years. And so folks who either have a friend or a loved one or they themselves have structural brain disease, it's really worthwhile to seek out an opinion, because what we can do about that problem has really changed dramatically.
Let's talk about those changes over the last decade. Like, what kind of things are available now that maybe weren't available 10, 20 years ago?
Yeah, well, as you can imagine, if you have a brain tumor or an aneurysm or a vascular malformation in your brain, being able to get there safely is quite important. So our ability to visualize those problems, the use of navigation, the use of devices to actually map the function of the brain allows us to treat those things much more safely than we could 5 or 10 years ago. So things that previously weren't operable are now treatable. In addition to that, as you've all heard about changes in the biology of tumors, we're able to provide very targeted therapies based on tissue now that we couldn't 3 or 4 years ago.
Wow.
So what makes UC San Diego Health unique for neurosurgical care? Why would we go there?
Yeah, well, neurosurgery is a team sport, and so we've been a top 20 place for neurosurgery in the last 5 years, and the entire hospital is actually part of the honor roll. So as a surgeon, I rely on neurophysiologists, neurocritical care doctors, intensivists, and so all of them are really top flight. It used to be that if you wanted to have world-class care, there may be places that you would travel to. Now people travel to San Diego for that care.
So when I think about brain tumors, one of the first people who pops in mind, Jimmy Carter.
Sure.
Okay, at 91 years old.
Yeah.
Right, had brain cancer, survived. Talk about like what treatment he got 8, 9 years ago, and how that may have factored into what changes today.
Well, the reason that's such an interesting story is because President Carter actually had a cancer that actually spread to the brain. And 10 years ago, it used to be if you had a primary brain tumor, that was one of the main reasons you need a neurosurgeon. But because our treatment of systemic cancer, like melanoma, has grown so much, now 2/3 of the surgeries I do are actually for metastatic lesions, because we have such good systemic therapies for other forms of cancer. And so it used to be that if cancer spread to your brain, that was the ball game, but that's no longer the case. Now neurosurgeons are involved in those cases more than ever before.
Wow.
We mentioned Jimmy Carter, but with HIPAA in mind, are there any cases that stick out to you that you remember specifically?
Sure. Well, I think what it comes down to, and I think the most important thing, independent of individual patient situations, is cancer care in particular is a journey. And each patient in each case is different. And so you want to be, as a surgeon, a reluctant warrior. So there's times where you have to operate right away because the disease puts you in that position. There's other times you hold surgery in reserve. And so patients who are on a cancer journey, the most important thing is for them to realize when there's good data-driven standard of care, you want to take advantage of those therapies. And as your case progresses, when you're actually entertaining things like clinical trials, it's quite important to be at a center that has the full complement of treatments. And obviously our Moores Cancer Center is at the top of that list.
Dr. Kalesi, while we have you here, I want to ask you this kind of, I don't know if this is like off the board here, but
yeah.
I want to ask you about Neuralink.
Yeah, sure,
right?
please.
So people are talking about, obviously using AI, what is that? Where are we on that? And how realistic is it? How safe is it? What's the deal?
Yeah, so for the benefit of your viewers, Neuralink is a technology that's under trial now. It's obviously a company that's founded by Elon Musk. It happens, one of the head neurosurgeon there, Matthew McDougall, is an alumnus of UC San Diego and in our residency training program. And so they've only implanted 2 patients at this point. And so it's a low-profile device that's able to actually take signals from the brain and stimulate in a very focused way to actually allow someone using their mind to actually move, let's say, a cursor on a phone or a computer. There are other technologies like Synchron who are actually implanting in blood vessels. They're achieving a similar aim. I think we're entering an era now as material science and computational power improves. You're going to see a lot of these brain-machine interface implants coming down the pipe in the next decade.
What do you think it's going to look like? I mean, are we going to have the internet in our head before long?
Well, I think the first step is whenever you're thinking about a new treatment, you have to think about the competing risk and benefit and the natural history of the disease. And so I think right now the focus is appropriately on people who have had strokes or ALS or conditions where you need to actually augment a loss of function. I think we're a little bit away from augmenting normal brain function because you need to have something that's pretty safe in thousands of patients before you subject someone to that risk. But I think we'll get there. Probably about 15 or 20 years from now.
Yeah, they're implanting their second patient apparently. So.
That's right. It's actually already taken place.
Before we let you go, and I apologize,
That's okay.
what are some of the signs that people should look for in terms of brain health? Really?
Yeah, well, in your central nervous system, location is everything. And so neurosurgeons don't just treat problems in the brain, they treat problems in the spinal cord as well. So if you ever develop persistent pain that proceeds to numbness or weakness, that's something you should seek care right away. If you ever actually have what we call syncope or a loss of consciousness, that can be an interruption of blood flow to the brain. If you have a disturbance of speech or vision, those are the things where you want to get structural imaging and seek care right away.
All right, important stuff from
It
brain
is important
surgeon,
stuff.
and we talked about rocket science as well.
That's right.
In a break. You guys were sending up some stem cells to space as well, right?
Yeah, well, one really exciting things about being part of an innovation ecosystem in San Diego like we have is Kat Jameson, our partner at the Stanford, has started an astrobiotech hub. So we're learning a lot about neurodevelopmental and neurodegenerative disease by sending stem cells to space.
Wonderful.
That's
All right.
such good
A little
news.
lesson
Gives
on
us
brain
hope.
surgery and rocket science all in one.
And gives us a
tried
little
it.
bit of hope. That's
Yeah,
important.
there's a lot to be hopeful about.
All right, Dr. Kalesi, with UC San Diego Health, we appreciate you being here and explaining to us and hopefully helping some folks out there.
Great.
Thank you.
Thanks so much.
Thank you.